Hi everyone, it's Henry from the Rehab Bar. I'm just going to quickly explain to you some muscles of the lower limb. I'm not going to call this anatomy for dummies, I'm just going to call it anatomy for everyday people who are not PTs, therapists, sport rehabbers, sport therapists, or any healthcare practitioner. Start from the top, we're going to spin this bad boy around. Your glutes. Now, this is the gluteal region. The main function of the glutes is essentially to abduct your hip. So it does somewhat abduction of the hip. So to abduct is to take away. It also helps in the hip extension. So to bring your hip back like so. And it also helps with external rotation of the hip. Now, your hip internal rotators are also found in the gluteal region. 6 of them. We're going to go into them another time. Now, moving down a bit, your hamstrings. Everyone sort of knows about the hamstrings. The hamstrings' main job is to basically flex your knee, so they help you to bend your knee. So the muscles that help you to bend your knee are located at the back. And on the side, you have your TFL and IT band. So tensor fasciae latae and iliotibial tract. Now, on the side, you do have the muscles that also help you to abduct. So you get your abductors on that side. Now, on this side, yes, you guessed it, the opposite. They would essentially be helping you to adduct, so to add in, okay? So the muscles that help you bring your leg in this way are your abductors, okay? Those are like playing football. The techers are not great, but yeah, that's basically where it is. Moving to the front, you have your quadricep muscle group, 4 of them. Essentially what they do for you is to help you to flex your hip and extend your knee. So quickly moving down, the muscles in the anterior compartment, so on the front of your sort of shin muscle. Now, essentially these help you to dorsiflex your foot, your ankle. So they basically help your ankle to come up this way. If you put your hand there, you can literally feel it contracting to get it up. And then posterior, you've got your calf complex and your Achilles tendon making its way down. Okay, so if this is helping you bring your foot up, then of course the opposite, the calf, is helping you bring it down. That's why these are called calf raises, because your calf needs to contract for your ankle to do that movement. That's called a plantar flexion. So yeah, we're going to cover this a lot more in detail as we go on in the video series. This was just a quick run through. Enjoy.